Okay. Hi, everyone. Welcome to this live Q&A about the Clinical UX course for 2022. My name is Dr. Gyles Morrison, and it's with great pleasure that I have this opportunity to speak to you about the course that we're starting from the Clinical UX Association next year, January 2022. So thank you for joining now, whether you're joining live or listening back to the playback. It's still great to have you here. Please do leave your questions that you may have in the live stream. We will be putting those throughout the next 60 minutes, but I also have quite a lot of questions that people have sent in ahead of today. So first off, I just want to go through the agenda. So welcome. I'll give a bit more of an introduction about myself, followed by talking about and discussing the aims and objectives of the Clinical UX course. We're then going to review the actual course structure and the syllabus. We're also going to be joined by a couple of recent graduates of the Clinical UX course, and of course, answer any questions that come from the audience. Now, we may be answering quite a lot of the questions as we go along throughout this agenda. And again, please do present any questions that you have in real time. I'll pick them up and I'll be able to start answering them. So first thing then, about myself then. So my name is Dr. Gyles Morrison. I am a clinical UX strategist, and I'm the lead instructor for the Clinical UX course. So my day-to-day work is really ultimately about making particularly digital health solutions and training people who work on such projects and creating such products. So they may be UX professionals themselves, but they could be engineers, project managers, all kinds of different professionals, even managers who are interested in ensuring that these different digital health projects that they're working on actually lead to successful products. But my skills lend themselves also to the design of services in healthcare and also physical products. And this all comes from previously working as a medical doctor for 3 years before being in digital health and clinical UX since 2014, so just over 7 years now. Now, the clinical UX course actually started just over a year ago, back in 2019, just before the pandemic hit everybody and started changing our lives dramatically. And it's been joined by students that graduated only a few weeks ago, in fact, of this recording, just back in October of 2021. So the course, just going more into now this second agenda point, just to know more about the course. The course itself really has one main objective based on a key principle that we have here at the Clinical UX Association. And to us, ultimately, better design in healthcare can improve health outcomes for all. Therefore, we train the next generation of clinical UX professionals. That's something that I really take particular pride of, the fact that I've come from a medical background to now get into user experience design in healthcare. And then I use my medical knowledge in order to design clinical and patient-facing products that are actually really going to improve health outcomes. But you don't have to do it just from a medical background. You can do this coming from a completely non-medical background. You may never even have worked in UX before. That doesn't matter. What matters most is why you're doing this. And to us, it's that people deserve to be healthy. People deserve to be living great lives free of disease. And that's what ultimately the course is, helping people be trained in being able to use design skills, design principles in order to make those solutions that are going to improve people's health and well-being. But clinical UX, there's a lot of talk about clinical UX, obviously, in the course called the Clinical UX course. What actually is clinical UX, and how does clinical UX differ from other forms of UX? So just looking at this in a bit more detail, clinical UX ultimately is UX. It's very important that we recognize that there's a root to what clinical UX is, and it's the UX, not the clinical. The UX is the root of it. And UX is about the experiences that people have with anything designed. And when I say anything designed, I really mean anything designed. So we're not talking about, oh, I've had a reaction to rain. I've had an experience with this rock. You know, I've had an experience with this sunlight. Like, these are natural forming things. But we can actually have an experience that's been designed because of the sunglasses that we're wearing, because of the sunlight, of the umbrella that we're using to help shield us from the rain. So it's actually looking at something that has been made by people, not something that naturally exists. This is the sort of experiences that we're trying to deal with here. So then looking into this then in a bit more detail with regards to healthcare UX, because clinical UX doesn't just come straight from UX. Clinical UX is a subsection within healthcare UX. And healthcare UX is about the experiences that people have with healthcare technology and services. So we've narrowed that breadth of what could we possibly be dealing with from anything down to actually a focus on something that is relating to healthcare. So it could be any sort of digital, physical product or service interactions between people in healthcare. So the common thing is people can think a mobile health app, but it can also be the electronic and digital blood pressure cuff that you have at home. It could be dealing with blood sugar monitoring devices. It could also be other physical devices that's used to just actually detect changes in someone's blood because you've put it through an analyzing machine. It can be stuff that's actually more related to how do you get a mass population to be vaccinated against COVID-19. All this comes under that whole sort of sphere of healthcare UX. The main thing is that healthcare UX can also deal with things that had nothing to do with actual direct patient care or the tools that clinicians are actually using. It could just be processes such as the paperwork processed by legal teams in healthcare. That can still be a healthcare UX project because there's some amount of knowledge of healthcare or the process in healthcare might be needed in order to do that work. But the key distinction here at healthcare UX is that actually having medical knowledge or having experience in healthcare isn't essential. So moving on then to specifically clinical UX. Now, clinical UX is a niche within healthcare UX. And this actually shifts the focus from generally all types of people to now clinicians and patients specifically, and how they are having experiences with healthcare technology and services. Now, the thing that's really important to keep in mind with this is that when we're focusing more on clinicians and patients, it doesn't mean that we're excluding any other type of people. We still have to keep in mind the experiences that non-clinicians, people who aren't identified as patients, people who aren't actually actively sick, the experiences they have. But it's having this deeper knowledge of what goes on for clinicians and patients requires knowledge of healthcare, deep knowledge of healthcare, deep knowledge of the processes that patients are going through and the struggles that they go through and opportunities they have to improve their health, about healthcare economics, just generally about the different types of technologies used in healthcare and the realities of having to create change in a very complicated healthcare ecosystem, whether it's on a global level or local to literally where you live. Now, all of this is the sort of stuff that we learn on the course. And so feeding into the next step really is just knowing more about that course structure and syllabus. We're actually going to take a look on the website. So what I'll do now is share my screen to share the course with you. Just bear with me. The joys of modern technology. Right, so syllabus. So what I can do as well is share this link in the chat so that anybody who wants to visit the syllabus can just find it here. So the syllabus is ultimately 3 units. There's a 4th unit that students can take if they're taking the course over the entirety of the 12 months, if they're using it actually to change their careers. Because students can actually isolate to just 1 or 2 or 3 units. But the main units is the fundamentals of clinical UX, applied clinical UX, and advanced clinical UX. And we'll talk a little bit about this bonus one about professional development in clinical UX. So this first unit on fundamentals of clinical UX, this is really something that people who are new to UX are going to need to be learning. So let me just bring this up on my screen now. So these fundamentals of clinical UX part, this is really, really important, like I said, for people who are new to UX. They've never actually dealt with UX before. And so they need to have an understanding of what is the design process, what actually is UX, how do you define it? And then what is the core things that needs to be known to actually do UX work? What are the tools and techniques that are applicable to UX? And in particular, that stuff starts with that first module, the clinical UX essentials. And as you can see here, it talks about understanding clinical UX, the core competencies, the design process, heuristics, which, as it says here, is how people learn to use new products and services easily, effectively, and without error. And it talks about the tools and the way that we can assess and ensure that UX work is being done properly on a project, and whether actually a product or service is adhering to these 6 measures that determine whether UX is actually good or not. And how there's not always times when you're looking at improving a whole problem. You might be trying to improve a situation where it's not a problem, it's just that things could be better. And so that's why we call that particular topic improving experiences, and then looking into emotional design. So I'm not going to go into too much detail about every single topic, but the main thing is that this UX essentials, clinical UX essentials part, just gives you that foundation that we build on to then understand more about, well, what are the actual tools and techniques and methodologies that we should be using to actually do the UX work. So different research methods and how you analyze the findings, actually how you plan out this research to then execute it effectively, and what are the different types of design methods that we can be using, where we've now got these requirements, we've got these suggestions of what could be a good product or service. How does that actually get fed into an iterative process to make something that's actually going to be useful and become a reality, not just an idea? And how different design principles and design skills and knowledge feeds into all of this, particularly how people interact with digital solutions, and how to make it accessible so that any form of disability, whether it's real or perceived by the user, none of that's going to stop them from being able to engage with a product or service. And then there's UI design, so actually how to design these user interfaces, and a bit about understanding about coding and databases, which you don't have to do as a practitioner, but understanding why your development colleagues are doing what they're doing, understanding a bit about their language is really, really helpful for you to work effectively with them. And that leads into that last topic then, effective clinical UX design. And this is really about, now that you're working on a project, how do you work with others? How do you turn this project idea, this brief, into a real product, something that people actually use? So then the next unit then is the applied clinical UX. This is a very meaty unit that's much more focused, less so on psychology and design, although that's still in there, but it's much more emphasis on knowing more about healthcare and technology in healthcare. And so you've got realities of healthcare, which looks more about, well, what is actually the journey that a patient's going to take when they're sick? How do you actually treat disease in a general way with specific examples of common diseases, but also what are the priorities, what we should be focusing on? And how do we encourage people to adopt healthy practices in their day-to-day to keep them healthy? And then what are the realities in healthcare that then impacts the way you actually do design work? And finally, who are the people or the stakeholders that you have to engage with? And then we look at different types of technologies in healthcare as well. So here in particular, we're thinking about different types of clinical applications, stuff that could be used by clinicians, by the general public, by specific patient groups, and how this all ties into delivering care. How human factors and ergonomics and risk to harm comes into all of this, and how we actually can effectively reduce harm even happening in the first place, and how laws and regulations, security, privacy ties into all of this. And there's behavioral science, which ultimately is how can we use an understanding of how people behave in order to predict their behaviors and encourage them to adopt more healthier ones. And then finally, looking much deeper into an understanding of clinicians and patients and how we can effectively design for them. This third unit now is the advanced clinical UX. This is much more into that core competency of professionalism and what does it mean to effectively work as a clinical UX professional. So now that you actually know how to do clinical UX work, actually, how do you make a digital product for clinicians, for patients? What does this mean when you're then working in an organization and they say, we don't have any budget? They say, oh, we don't really need to do any research. We already know our user. And they're not following best practice in design. How do you actually use more advanced technologies where there's bold claims of how they could be utilized? And unfortunately, it takes a lot longer than certain managers, certain people encouraging that technology to be used. It takes a lot longer than they actually ever would have imagined or ever planned for, budgeted for. And so these topics of designing for emerging technologies is really important. Just knowing how do we use artificial intelligence, augmented and virtual reality, ubiquitous computing, and actually using this and tying it into actually real good offerings to people. and then you looking more into designing for complexity. And this is a topic known as socio-technical systems, which ultimately is looking at understanding that complex web between people and technology. So you go to a hospital, there's all different specialities, but then there's all different types of professionals under one type of speciality, clinicians, non-clinicians. And if you're a patient and you've got different diseases or different problems, you may have to go to different departments that all work differently. Trying to create a change in one department could dramatically impair the quality of care given to a patient because of the impact it has on the other departments they have to work on. Just thinking, well, how do we improve this socio-technical system? How do we improve this complex web and make sure that we're bringing positive change rather than negative change? So we explore that further. And the last area is that UX maturity piece, where it's the realities of working in organizations that don't really understand UX, aren't taking it seriously, aren't funding it properly. How do you actually still then develop a UX capability and make it effective? This last unit now is one called professional development in clinical UX. This is ultimately about someone who's changing careers. They're having to work on their personal brand, think about ways to ensure that people recognize who they are, what they have to offer, and their value and their worth as a clinical UX professional, and ensuring that they're not becoming their own worst enemy because of imposter syndrome, where you doubt the actual fact that you've got the knowledge and skill to do a great job. And how do you actually continue that development of yourself? Because UX really does demand lifelong learning. And how does that tie with mentoring, coaching, and supervision? So that's a whistle-stop tour, specifically to look at the whole clinical UX course. Then the other question that I wanted to have answered at this point is just understanding the fact that the course itself is taught through what we call a blended model of mixed learning. So that means that there is self-directed learning that's happened through e-learning. So you're given access to a variety of videos and texts and assessments that you're able to do on your own. The assessments are graded automatically. So you learn at your own pace most of the theory and core skills, followed by tutorials that happen on a weekly basis where you work with teaching assistants and also meet with myself. Students are also going to have one-to-one. So it's not just in group settings where you're doing workshops and learning with other people, but also getting that personal experience with myself to see, well, actually, where are you at? What are your individual learning objectives, learning needs? How is the course supporting them? Where's there gaps in your knowledge? And how do we ensure that your learning objectives are actually achieved? It's really important because as much as there's a baseline knowledge that all students need to have, there's still an agenda that every student has. There's still something of a particular topic or interest area that they want to focus on, or a project that they're working on now that they want the course to support them with. So having that one-to-one sessions facilitates actually getting that meaningful personal feedback and support and direction to help the students. So swiftly moving on then, the other thing I want to cover now is really just speaking with a few of the recent graduates. So we've got a few people here joining us. I'm going to bring one of them on. I'm going to bring on Jack Burton. I don't know if you're ready, Jack.
I'm ready indeed, yeah.
Wonderful. Hi, Jack. How are you doing today?
Hello. Yes, I'm very well, thank you, Giles. Thanks for having me. Good to join. Glad to see you as well and kind of talk through things.
Wonderful. So, Jack, you've taken the course last year, and of course, it's very easy for you to be heavily pressured to only say great things because it was me that taught you. But it would be great just in your own words to just share with those listening now. How has the course helped you, and where are you now with your career?
Yeah, so as you said, so I took the course last year. The easiest way to describe how it's impacted my career is that it has actually enabled me to start a career now as a clinical UX professional, working for a company called Graphite Digital. So we work exclusively in digital healthcare and pharma, which is fantastic. And obviously, I'm now doing clinical UX work, I would say, as a result of the learnings over the past year and from the course. So I came into the course with a background in psychology and health psychology, but no background in UX or kind of product design or anything like that. So I knew that I had skills that I could bring to the research side of things, and kind of UX research was something that I really wanted to pursue. But I just wasn't sure, obviously, of how to A, go about that, and B, how to gain kind of practical, I guess, healthcare specific work and obviously knowledge as well, to kind of support that. So the course has been very instrumental in doing that for me and helping me to kind of progress in that sense. So I think from the kind of first unit that we went through, the fundamental kind of UX unit, I was able to pick up a lot of skills there that I didn't have previously in just terms of the basics of UX, kind of product design, and all that kind of stuff. But I think what I really got a lot of value from more so was the kind of later units in terms of actually knowing what it means to be a clinical UX professional and kind of what the realities of working in the sector are. Because as you said, it's not, and I think this is the case not just in healthcare, but maybe specifically does apply to healthcare, is that there are no perfect projects. There's always constraints, there's always regulatory constraints, whether it be kind of, certain constraints on projects in terms of resourcing and that kind of thing, or obviously regulatory stuff and compliance. So just learning more about that and kind of how to apply that with my research skills was very, very useful for me. And also, I would say another highlight was actually working with some of the colleagues that I had the pleasure of working with. So the course was able to draw in a lot of people from internationally and from different backgrounds, with a lot of different perspectives, not just from clinical backgrounds as well, but from product design and UX backgrounds. So there was a nice kind of mix of different perspectives, and everyone has something different to bring to the table. So I think I got a lot from that as well. So a very fruitful year, and very much did enjoy the course for sure.
Wonderful, wonderful. What would you say would be a big reason for people to take the course based on your own experiences? Why should someone take the course in your opinion?
I think someone should take the course if they are serious about working within UX and within product design in healthcare. I think, as I said, you can learn kind of theoretical knowledge and kind of healthcare knowledge and things like that, and then kind of muddle your way through to apply them with UX principles. But I think actually kind of being an environment where the core pillars are very much, we're doing this for the patients and to improve lives, and because everyone does have a right to healthcare, which I very much believe in as well. And I think that kind of environment really fostered a more kind of accelerated learning, I would say. So I think that it was whether you're a clinician or whether you're just serious about kind of starting a career in clinical UX, that's when I would consider taking the course.
Wonderful, wonderful. So we're getting some questions coming in. So I want to actually take this first one that's been popped up here. So this is Elizabeth. Thanks for this question, Elizabeth. So does the course cover also medical device for clinical use, in particular for human factors, FDA approval process? So we do definitely teach about medical devices and clinical use and the general understanding of the regulation that's required in order to register a medical device. So we don't go through every single form and all the details of all the paperwork that's done for FDA approval, because generally speaking, a UX professional should not be doing that. The main reason being is that if this is being done even by a startup, they will actually employ somebody who is specifically employed to do that paperwork piece. What is important is to understand is that there's lots of evidence that needs to be provided for not just for the FDA, because that's very much for the USA, but any medical device regulation in any part of the world. So there's different departments, different organizations that do that in Europe and in the US and other parts of the world. It's really important to understand how do you as a UX designer support that process and not be a hindrance to it. So definitely understanding, for example, how you're supposed to document and why you're documenting things, so that feeds in how you do that documentation piece is definitely part of the course. So yes, the students will learn how to be prepared to work on making medical devices, in particular software as medical devices. Hopefully that answers your question, Elizabeth. So I want to bring in a few more students then. So we've got Niku and Damien Sherman, Damo, as he likes to be called. Let's bring you in and unmute you if you're available. Right. Hello, Niku. Hello, Damo.
Hi,
Welcome
everyone.
to you both. It's wonderful to have you here. So let's start with you, Niku. Do you want to just share a bit about yourself, what you're up to, and why you decided to take the clinical UX course?
Yeah, for sure. Hi, everyone. I'm Niku. I'm calling in from Canada. And I came into this course, I think, with more of an understanding of the health aspect of things. I did an undergrad in science and then a master's in biochemistry working on brain cancer. So I had a bit of an understanding of how health systems worked. But what really interested me in this course was the design education and how that fed into the healthcare aspect. One of the most memorable things was the distinction between digital health and service design and health for me, and how both of those could be considered as health tech. And I found myself more interested in the service aspect as well, which we discussed in the course too. So yeah, it's really helped me to look at the projects that I'm involved in from a different angle and bring that human factors perspective into it, which not a lot of people consider upfront. So I'm kind of an advocate for that in the work that I do.
What was also good to note as well for everyone listening is that Nika, because you've already got experience in UX design, and you've dealt with boot camps and worked on a variety of projects beforehand, you actually entered the course after Unit 1. And this is something that can be done for students taking the course, is that if you're already a practitioner UX professional, or you've just recently graduated from a UX boot camp or master's degree in human computer interaction, something like that, or even if you've been doing UX work, but you've mainly been self-taught, if you can demonstrate competencies in actually understanding that fundamentals of clinical UX, then actually you can enter the course from Unit 2, which is really, really useful. Like, generally speaking, I wouldn't advise anyone who already does UX work to do that first unit. There is stuff that you can learn from it, and there's ways of picking knowledge from that first unit in other aspects of the course, but joining a bit later is definitely a better option for you.
Yeah, something to add on to that is that even though I joined later, I always found that I had the support that I needed if I didn't even understand a certain topic because of the
Mhm.
Slack group, because of how available you were as a mentor. So I wouldn't even fret if you don't understand something from the first bit, that it's done and there's no way to go back to it.
That's right. That's right. So, Damo, just shifting to you. You come from a very different background to both Jack and Niku. Do you want to just share a bit more about your background and why you decided to take the clinical UX course?
Yeah, so I come from a clinical background. I've spent the last 20 years as a paramedic here in the UK. I left working in the ambulance service, but felt that I'd still got quite a lot to give to try and help people, and came across this clinical UX. And thought this might be something worth looking at. It might be a way that I can use the knowledge and the experience that I'd built up over the previous 2 decades, and take that and use it in what some might say is completely non-traditional way of trying to help treat people, rather than running around on an ambulance, jumping out at road traffic accidents and heart attacks, looking
Mm.
at ways at trying to help prevent these things from happening in the first place.
Mhm. Wonderful, wonderful. And what sort of stuff in particular have you learned from the clinical UX course? Because it's quite a drastic change for you. Because if you're dealing with clinical work, dealing with clinical UX is quite different. So, what in particular really stood out to you on the course and helped you to learn and make that transition into clinical UX?
Well, as Jack alluded to just a short while ago, one of the things that I found, and it wasn't particularly the course content, but like working and studying with people from so many different backgrounds, all across the planet, really helped to open my eyes to see things from many different perspectives. So,
Mhm.
working in UX and having a clinical background myself, um, being able to see things from a patient's point of view, or any other sort of user's point of view, was quite good. Being able to help my colleagues also who didn't have a clinical background,
Mhm.
so that taking the course really helped to enable me to see that even though my background is clinical, it doesn't have to stay clinical in the
Mhm.
traditional sense. it opened my eyes into seeing that I can use my skills and knowledge and experience in so many other different ways.
Wonderful, wonderful. So I want to just go to some of the questions that we've had. So quite a lot of questions came in ahead of today's session. We're going to hopefully be able to get through all of them. There's also some questions that have been coming through the live stream as well. So the first question I've got here, and at any time to Jack, Niku, Damo, if you ever want to add your own points to any of the questions, please feel free to jump in. It's never a problem, okay? So the first question we've got here is, will we be transferred to a job afterwards? So in short, the answer is no. Like, we cannot guarantee a job, and no bootcamp course, no course, whether it's a master's degree in human computer interaction or General Assembly's 1 week course in UX, none of them can guarantee a job. You still have to apply for jobs, or someone's in your network who's able to give you some advice and guidance, or actually just offer you a role. There's still a process to get jobs. With that said, and this is a really important distinction that we have to make with regards to this course, is that the nature of the fact that we do connect with partners, and that I regularly get approached with different types of projects, and you actually get one-to-one coaching from myself. And there's also a partner provider that provides specific support in interview preparation and portfolio preparation. Because of the network of people that we have, you are more likely to be able to get a job, not just because you're prepared to get that job, but because there may be people within our network who is sharing job opportunities, and this is then disseminated amongst students. So it's not a guarantee. It's like someone saying how, if I've given you a series of numbers, you're guaranteed to win the lottery. No, but unlike winning the lottery, you're much more likely to get a job through doing this course. So we can't guarantee you actually getting a job straight afterwards. But one thing that students are open to doing, one of our graduates in particular has been working on a project specifically looking at how we can support people living with sickle cell disease. And they're specifically looking at how can they turn that product into an actual real product. So it's a project they were doing on the course, building on some of the lessons that I've learned even in my master's degree, and they're trying to commercialize that. And that's definitely one of the options that some students can take. And it's something the course does support with learning on, is how to be an entrepreneur. This ties in with that unit that I was mentioning before on professional development in clinical UX. So just bringing that back up on the screen, where it looks at strong personal branding, pursuing purpose. These things do start going into the realm of entrepreneurship. So if there's something that students want to do, where they've got a great idea for a product or service in healthcare, and they actually want to run with it, the course can definitely support you in doing so. So let's move on to the next question then. So where can a dentist work as a clinical UX professional? So ultimately, it depends on the interest of that dentist, if I'm honest, because the no-brainer answer would be, well, you can apply your skills to dental products, whether it's digital products that improve someone's dental and oral hygiene, or physical products, or even just the general service delivery of dentistry. So because that huge domain knowledge that a dentist has lends itself to staying in dentistry. With that said, just having understanding of clinical pathways, patient journeys, of health economics, just the realities of healthcare, which these sort of students, someone who comes from a clinical background, you'll already have some understanding of this. It's then just tying in, where does the UX component, where does understanding about technology and processes and service design come into play? You can then work in any sort of healthcare organization. It could be in a hospital, it could be a digital health startup, could be a big pharmaceutical company, or a large corporate organization in digital health or physical product design. So we're talking about Philips, we're talking about Johnson & Johnson, AstraZeneca, and the like. We're talking about big companies or startup ideas. You could even do your own startup idea. So to be honest, there's a huge breadth of options. And this again is when you're on the course, you can get that one-to-one coaching, that support in deciding how do you want to building your personal learning objectives where you're trying to achieve what you're trying to achieve with the course, and get support in actually achieving it. Right, I don't know if anyone, Jack, Nico, Dama, you had anything to add to that? Nope.
I just wanted to say something quick. Something that occurred to me throughout the course is that the things that I had in mind about how I would be using these skills evolved throughout the course, and it opened doors that I didn't even know existed to me. So roles like product designers or product managers or things like that. These new role ideas that I didn't even know about. So I would say go in with an open mind and don't let the confinements of your role define what the skill set can really do for you.
Yeah, thanks for adding that. It's really, really true. I think this is very similar for any clinicians that are listening, that when you even just decide you want to be a doctor, before you even entered medical school, let alone, completing the medical degree, you could have a bold idea that you want to specialize in cardiology, and then you realize actually you really like neurology, or you think about having a more medical role, something that's more hospital based, and then you decide actually no, I want to be a physician that works in the Navy. And then there's also the option of going down the surgical route, and it's only until you actually start having practical experience in it you realize, no, I don't like standing out for so long doing surgery, but I really love sitting down and dealing with elderly patients who are a bit confused, and then getting them back to a state where they're lucid and where they're actually able to take more control of their health. And it's suddenly, it's because of the experience and time passing that you narrow down to what is the right path for you. It's very much the same in UX. Because for me, for example, when I started out in UX, I knew that I wanted to work on digital products, but I thought it would be more so stuff that would be clinician facing. And as time has gone on, I've really enjoyed working on digital therapeutics, which still has a clinician focused area, but it really is about how can we give digital tools to patients that are evidence-based is going to help them prevent, manage, or treat disease. So let's move to one of the questions that we got in the live session here on YouTube. So Victorine says, the live sessions for the course, at what times do they occur? So there's different options for the course, and there's still a little bit of tweaking and planning that we're doing for this. But generally speaking, there should be at least 2 live tutorial sessions per week. And because of the nature of the cohort of students tends to be global, so students in the US and also in the UK, we try to have tutorials that can happen outside of working hours for both those time zones. So there's normally going to be a session that will happen perhaps in the afternoon for the UK, which could be still in the morning time for the US, and an additional session that is the opposite, where it could be morning time for the UK and evening time in the US. There's also protected time on the weekends where students will be able to meet with me in a group setting, and also with other teaching assistants and guest lecturers. So some of this will change on a week-by-week basis, and there may be additional top-up tutorial sessions in certain parts of the course, depending on what's being learned. There's sometimes when there's a lot of practical work that needs to be done, a lot of assignments. So that feedback in group settings is really, really important. And there's other times when you just have to get on and do the work in private time. So there's less of a need of tutorials that are extended periods of time or regularly. It's more so designed so that people are actually able to answer a few questions over a half an hour period and then get back to work or get on with actually their weekend or their evening or morning. So there is flexibility with this, and it's really important to keep that in mind, is that the main thing that is fixed is the fact that you need to devote at least 3 hours a week to the course. So you've got about 2 hours of doing some studying, and it could be something that's more the self-directed learning that's provided with the e-learning online, but also books, articles, videos that are being shared to deepen your knowledge on certain topics, which you're free to do. It's not mandatory. The only thing mandatory is the e-learning that's put on online platform. But then also time to just check in either in a tutorial session or one-to-one with myself. I think it's really important that you're not just left to learning on your own in isolation. It's impossible to get good at UX by learning on your own. You can definitely learn UX on your own, but being good at it, actually making solutions that make a difference on your own, it's not going to happen. And if anyone tries to prove otherwise, I would love to have a wonderful heated discussion with them. You know, UX really is an apprenticeship. It's very important that you get that opportunity to learn from people who are in the same situation as yourself. That's peer learning, and from people who have learned and have put what they've learned into practice before you. That's through mentorship. That's listening to seniors. And then when the time comes for you to actually pass that knowledge on to others. But back to that question, there's going to be times for sessions in the mornings and in the evenings, depending on your time zone. And it also happens over the weekend as well as during the week. So take up another question then that we've had. So this says, would we work on projects or have lectures only? So it's definitely both and more. It's really important that students are able to just learn the theory through didactic teaching, which is provided that people can consume on their own at their own pace at any time. And also learning in a group setting through feedback and discussions and actually working on scenarios, working on assignments together. But there will be projects, and there's two types of these projects, as I mentioned before: assignments. So there's actually something that someone is doing based on a scenario that's been provided. So there's some guardrails put up to protect all the variables, not having so many things to consider, otherwise it's just a bit overwhelming. But there is an endpoint for the assignment, and then you get feedback on that, which is different to an assessment where it's graded automatically when you do certain quizzes on the online platform. But then there's also a more extended project where it's something where everything that's been taught into the course, whether you're starting at the fundamentals of CUX or the applied CUX unit, whichever part that you're entering the course, that you have to weave in all that you've learned into that course project. Now, that core project is something that you could be doing in your day job. So if you already work as a clinical or healthcare UX professional, or you're working on healthcare projects, but you're not necessarily a UXer, you can use what you're doing in your day job as that project so that you can learn from that. And some students have actually done that, where they're already working even in a very senior position in more management and direction or research, and they've applied what they've learned in the course to the day job. But it can also be your own project idea, or project idea I present, or a partner organization presents, and then you work through that. But you also learn from actually just having feedback from myself, from other instructors, from teaching assistants, from your fellow students. You're also going to learn through your own self-directed learning that can happen when we provide you with different learning material, books, articles, videos, and the like, which you then use to deepen your understanding on a particular topic. Hopefully that answers your question. So again, Jack, Niku, Damon, if there's ever a time you want to jump in and anything, please just let me know. So we've got another question here. What time slots will be flexible or videos available in case work hours get in the way? So yeah, as I was mentioning before, it's totally fine for you to work a full-time job and do this course. This is exactly what a lot of students on the course have done, actually, is where they've gone through recordings of sessions, and then they will meet up for occasional tutorial sessions, or just meet up with colleagues, whether it's in person, with COVID permitting, or on Slack, which we were using previously, or even on WhatsApp. That people have developed friendships because of the course. So it's very important that the course is flexible. So that is the option for you. Just some feedback then from Jack, Nico, and Damo. Did you find that the course was flexible enough for you to do stuff during your working week?
Yeah, personally, I did. Of course, everyone has a very busy schedule, and kind of there's a lot to do during the weeks. But I think in terms of the way that it was laid out and structured, you have your protected time at the weekend, as you said, so you kind of have that blocked out. And then the workload in terms of the projects from kind of week to week and what you'd be working on for homework tasks and the like, I think that was reasonable enough in terms of the way that could be managed. I didn't at all, over the course of the year, feel like I had too much on, with the course and balancing other work. I thought it was very well managed. So I wouldn't fret about kind of having overload from the course or anything like that. So yeah, that was my kind of experience with it.
Cool. Right, so I'm going to take another question here then. So how do you transition from a clinical physician post to a clinical UX post position? So there's a lot that can be said about this, and that's literally what I've done. I came from clinical position to a UX position. I think the first major thing is that you need to be comfortable taking that career change, which you can either do because you've tested the waters a little bit, you've had a career break, or you've just done something on the side in UX, working on a startup idea of your own or someone else's. And from that, you've said, actually, yeah, I do want to do more of this. Or you could be a bit braver, like myself, and be like, well, actually, I don't want to work clinical anymore. I'll just completely stop. And the truth is that you can always go back to medicine, can always go back to a clinical role, whether it's doctor, nurse, pharmacist, whatever it is. You can always go back if you say that leaving wasn't quite right for you. And it does happen. We've had people that wanted to take the course and then they realize actually it's not quite right for me. And that's well within your right. You've got to do what's best for you. But definitely understanding whether clinical UX is right for you is the first step. And I think it's better to test the waters. And that's again why the course is done part-time. So you don't feel like you have to just completely leave what you've used to, what you're comfortable with. Especially because, if you're working as a clinician, you're earning a salary. If you were to completely leave and you're not working anymore, how are you going to make an income? So the course has always been designed to support people who are changing careers if that's what they want to do. Or they just want to learn more and then decide, I can use this knowledge whilst I'm still as a clinician on my own ideas for a project or someone else's startup idea, but I can still work clinically. I think the other thing as well is, and that's why we teach this on the course, that fourth bonus unit on professional development and clinical UX, is really actually understanding what's your purpose, like what you're trying to achieve with your life, because your career shouldn't just be something that you earn a salary from. I think a lot of us are conditioned that that's the only reason why you should be working is just to make money, but really you should enjoy what you do. It doesn't have to be this whole like, well, I'm a millennial, I've got to have everything my own ways. That's not what this is about. I think this transcends generations. You should enjoy what you spend most of your time doing. So it's then seeing, well, does this tie in with my purpose in life? Do I actually see myself doing research, doing design tasks, actually working in UX, in healthcare? You might not even want to do it in healthcare, but it's actually seeing where do you fit in the professional environment as a clinical UX professional, and how to market yourself, because you're going to have to look for jobs. It's completely different for clinicians looking for a clinical job than getting a clinical UX job. It's completely different. There's much more opportunities for clinical posts by simply knowing someone or even just having experience. That's it. Like you apply and you'll just get the job because there's often a shortage of healthcare professionals in different specialities and different types of clinical roles. So it's also getting used to that change of actually having to have a network and connections with people, having a portfolio, updating LinkedIn, which a lot of clinicians don't normally do. So it's actually, how do you market yourself? How do you have that network, have those mentors to support you with getting a UX role? So hopefully that answers your question. We've got another question that's come through here. So Eduardo, I hope I'm pronouncing your name correctly. So hello, what is the key differential value of your course in comparison with a product management or UX design course? So university or MOOC. So I think the main distinction for the clinical UX course above any other distinction is the fact that it is explicitly focused as an end goal on how to train someone to design digital and physical products and services that are used by clinicians and patients. That is the main goal. So you will learn how to create digital physical products and services in healthcare in general for anybody, but the ultimate focus is that this then becomes something that a clinician is happy to use, excited to use. Further to that, to then get patients to use these things as well. So that's the main distinction. Most other courses will just focus on, let's just make stuff good in healthcare for everybody. I think the other big distinction as well is that this course, as mentioned before, is really designed for people to do part-time whilst having a full-time job or even studying full-time. It's really important so that you can learn, develop these skills in a safe environment alongside what you're already doing rather than completely changing, because that drastic change could actually cause more problems for you, could actually hinder you, could actually mean that you're then, because things didn't quite work out, you're going to have to backtrack. And you don't want to normally take such a huge leap. It's better to just do it a bit gentler. I think that's the other major distinction. And I think the final one is the fact that the nature of it being part-time and the fact that you get to have one-to-ones with myself, other instructors, teaching assistants, and people who are specifically focused on clinical UX, that network of people, that environment to learn is very, very different to university, which can be much, much bigger. There's so many more people. There's so much more going on. Can easily be more distracted and less focused. So here's much more focused. And that focus ties in with the next point of it being a very, very practical. It's now that I've learned some theory, I actually can put this into practice on an actual project that I am working on right now, rather than I've learned something. I'm speaking from experience, having done a master's. It was a great master's, I learned a lot. But one of the biggest failings from a master's degree is that I was learning how things should be in an ideal world, which is far removed from reality. So when you then get thrown into a real world situation, you're overwhelmed. Like, this just isn't working out the way I was expecting. Why didn't this happen the way that Professor Jones said? Like, you don't want to face that situation, because then imposter syndrome can creep in, where it's like, well, did I learn nothing then? Where you actually start becoming disillusioned because things just aren't seeming to work the way they did back at university. So it's really important for things, for the topics that you learn, to be very practical. So I think that's the other big distinction.
Yeah, I can just speak to that as well, Giles. I can relate to that heavily. So I did my master's in health psychology at the University of Southampton, and as you were just kind of describing there, it was very theoretical based. There's a lot of behaviour change theory and kind of psychosocial approaches to health, things like that. And you can feel a bit, for me, it sometimes felt a bit removed from, well, how does this actually look in real life? And obviously, how does this look in terms of a healthcare intervention, or kind of actually, is this going to affect the end user or the patient, etc. Whereas obviously, I can pretty confidently say in the last year, I probably learned as much in terms of content, probably more in terms of content, because there's obviously the specific healthcare stuff, but then there's just a whole world of UX and kind of design principles to learn as well. So I probably learned as much, but I think the value add definitely for the course as well was the practical nature of it. And as you said, kind of being able to, when I was able to kind of pick up work and things like that, being able to directly apply something that I learned on the Saturday, the week after in a role, or kind of actually applying it to a project that I was working on. So yeah, I can definitely relate to that, and obviously just speak to Eduardo's point around kind of the university / this course distinction. So yeah.
Great.
Something else I just wanted to mention is something I don't see in a lot of courses online. I have done some of the courses, is the direct feedback on projects. There's usually not one person that you can go to, or a couple of people that will, be honest with you and tell you, hey, this is not working, or hey, let's track back and see what are the knowledge gaps that's leading to this problem. So I think that was definitely a highlight of the course for me.
Great. So I'm going to take some more questions that we've had in advance of this session. So this next question is, would it be possible to pay fees through our employer? So yes, this is very possible. We have had students do that. So in that specific case, it's important to email the finance team directly at the association. They can issue an invoice that then can be paid by an employer, because normally when students do the course, they're doing it as individuals. So they can go through just a very simple payment gateway on the website in order to pay their fees, whether it's to do full upfront payment or to do it in installments. So that's done automatically through the website. When they do the first transaction, it automatically then does a monthly payment if it's a payment plan option. But if it's for employers that need to pay, they're going to need an invoice and payment details. So this can be supplied upon request. So if you ever do have questions like that, You can feel free to just email the team, just info@clinicalux.org, info@clinicalux.org. I'll put that up on the screen in a bit, but it's, in fact, let me try and do that now for you. So email address is info@clinicalux.org. So hopefully that can pop up on the screen. info@clinicalux.org. So that's the email address that you can email if you have any further questions specifically about paying through your employer, or any questions, quite frankly, you can email that email address. Right, so let's keep going then. So here, what are the ways clinical UX can improve healthcare services, and how can these benefits be better communicated to clients and patients? So this is a really meaty question. We've only got a few minutes left, but I think this is a good question to follow up on. So the thing about clinical UX is that it can improve healthcare in so many ways. I think it's important that it can be done through showing a few case studies of, well, look how it's saved lives, look how it's helped this person manage their improve their health outcomes on their own without having to see a clinician. Look how it's saved time that clinicians are using. But the big thing, and we teach this on the course, these 6 measures of UX, looking at the usefulness, the usability and usefulness of a product, how accessible it actually is, how satisfying is it to use? Is it feasible to make? Is it viable? Like, is there money that can be spent to actually make it? Is it sustainable? And is it desirable? Do people actually even want it? And when you can tick these boxes for different products in clinical UX in healthcare, then you're going to start seeing how the improvement comes. But generally speaking, I think the big ways that you can improve healthcare services, how can you get people to manage their health without having to see a clinician? How can you get clinicians to do less mundane work, loads of repetitive tasks, and focus on the human aspect of their job, actually connecting with people and telling them a diagnosis, actually walking them through the diagnosis process and walking through treatments? And how can you actually prevent diseases in the first place at a global level, national level, and local level? This is something that governments and payers, insurance companies are really, really keen to do, is how can we just keep people healthy? Not just because it saves money, but ultimately, which is what we care about, is people deserve to be healthier. And in communicating these ideas to people and these benefits to people, really, ultimately, is through conversation. We talk about putting up adverts and posters and stuff in the post, but people love to hear a good story. I think it's being able for clinicians to actually speak to their patients that they're dealing with, and fellow clinicians, clinician champions who care about UX, to speak with each other is perhaps the most powerful way of having that story be told, those benefits. Right, so a few more questions. Conscious of time because we've got an hour. So we've got another question here from Joanna. So for a clinician considering a career in UX, not sure if healthcare related, do you still believe this course would be a good starting point? I definitely do. Trying to be as objective as possible with someone who teaches the course. I definitely think it's a great way to start. I think because of the fact that you will get the knowledge and the skills that you need to work as a UX professional. If you don't intend to work in healthcare, I would probably recommend a clinician to just focus on the first unit, which is the fundamentals of clinical UX. Now, there's 2 benefits to why the course is done the way that it is for the Fun CUX unit. The first one is that all of the examples, every assignment, every assessment, every example that's worked through, scenarios that's worked through, is always healthcare focused, right? So that means that the learning that you're doing can be applied quickly to healthcare, but it also means that clinicians can understand the topic so much quicker because it's using examples that they're already familiar with from a clinical context, and it's just bringing in the UX component. So it's really, really useful for clinicians to do that unit, whether it's just to decide if they want to continue down this path, or if actually they just want to leave it at that point. The other thing that's prudent for me to say is that there is a book that I'm writing, which is a clinical UX career guide, which can help clinicians in particular, but also non-clinicians who are thinking about a career in clinical UX. But I would definitely say that if you know that you want to do UX, then you won't do any harm doing the clinical UX course. Definitely not. But you may want to just start off with the first unit if you're not sure if you want to be a practitioner. You can always then pay additional fees to then take the other 2 units, add it on. Another question here. Does it make sense to join the course as a biomedical or clinical engineer? Did any engineer join so far? So we didn't have any engineers, but we have had people who have never done UX before, which I would say is someone who has less transferable knowledge, in the sense that they're not transferring knowledge about engineering, coding, and the like. And that wasn't disadvantaged, because what you need to know about engineering, what you need to know about healthcare, what you need to know about psychology and design, what you need to know about being a professional in this field is taught on the course. You don't have to have any prior experience to do this course. I repeat, you require no prior experience to do this course. If you did, then why would you be taking the course? If you already had enough knowledge, you wouldn't need to take the course. It's really supposed to be supporting people who have never done UX, never done healthcare, to now work as a clinical UX professional. If you come from a background in healthcare, in engineering, even in UX, in psychology and the like, this just puts you at an advantage. It means that learning certain topics is going to be a lot easier, but it doesn't mean that you won't still learn.
Can I just add to that,
yep,
Gyles?
Yeah, please.
I mean, obviously, I think the question is coming from maybe a biomedical or clinical engineer. We had myself as a paramedic, yourself, Gyles, a doctor. Paul was had a background in dietetics. You don't have to be a doctor or a nurse. There are so many different strands of healthcare that you could come from and benefit from taking this clinical UX course. It really does open your eyes.
Yeah. Wonderful. Thank you for that, Damo. So the last question I wanted to answer, because I know that there's been some people who have been asking about the fees and how much it does take to cost to actually take the course. So let's bring that up. So all this information is actually available on the website at all times, but I can bring that up for you now. So we're doing pre-enrollment now. So if you head to the website clinicalux.org, you can actually find out all the information about the course. So there's basically 3 options that students have when they're taking the course. The first option is what we call the foundation course, where you're just doing the first unit, the fundamentals of clinical UX. This is a 4-month period of study that starts in January 2022. This is ideal for people who have never done UX before. And if they're only doing this unit on its own, only these 4 months of study, it's good if they want to know more about UX, but they're not sure, or they don't want to commit to working as a UX professional. And so the fees for that is £2,500 in full, or £3,000 when it's split as £750 per month for 4-month payment plan. And then option 2 is the pro course. This is really great for people who have already worked in UX or have had at least some meaningful UX training. When I say meaningful UX training, I mean you've completed a course, you've actually had feedback about UX work. It's not just, I've read The Design of Everyday Things by Don Norman. That is not sufficient to demonstrate skills and expertise in UX. But this is 8 months of study. This is what a lot of students tend to do, is that they enter as a UX professional, and this will start from April of 2022. This is after the fundamental clinical UX unit has completed. And this is £4,500 in full for 8 months of study, or £625 every month for 8 months, or £5,000 in total on an 8-month payment plan. And then the last option is the full course. This is all 12 months. This is what most students who have never done UX before would take, where they want to maximize their learning in UX and actually become a UX professional, they're going to change their careers and go into this field. So that's all 3 units of study, plus the bonus of the professional development in clinical UX. This is 12 months of study starting from January, and that's £6,250 for the 12 months of study, or as a 10-month payment plan is £700 a month for 10 months. And obviously for any of these courses, there's a 14-day cancellation period. So if you join the course and you're like, you know what, isn't quite for me, there's no quibble about it. Within those 14 days of doing that payment, you'll get a full refund. But we don't expect you to do that. We expect you to have enjoyed the course and got value out of it. But yeah, I noticed we're a couple minutes over. So I just want to thank Jack, Niku, and Damo for joining us. Thanks again for being able to share your experiences, your thoughts, and helping to answer the questions. And thank you to everyone that's been in attendance, or if you're just listening to the recording, thank you for listening. And again, if you have any questions, please do send an email to info@clinicalux.org. And of course, if you want to find more information in general about the UX course, you can do so by just heading to the website clinicalux.org. So yeah, that's bye from me. Thanks again for your time, and I hope to hear from you soon. Take care now.
Nice, Charles. Bye, everyone.
Bye-bye.
Bye, everyone.